This summer, the town of Covalt, Texas, recently has experienced a higher incidence of a mysterious disease. An abnormal amount of residents have been experiencing symptoms like fevers, headaches, body aches, joint pains, vomiting, diarrhea, and rashes. Additionally, the majority of the infected people are elderly, like old. Mayor Brown's beloved daughter, Caroline, who is not old, has been plagued with even more severe symptoms. For weeks, she has had a high fever, headaches, neck stiffness, stupor or stupor, disorientation, tremors, convulsions, muscle weakness, vision loss, numbness, and paralysis. Unfortunately, one day she fell into a coma, leading the heartbroken Mayor Brown to summon a team of epidemiologists to Colville to save his daughter as well as to determine the identity of this disease, its related symptoms, treatment, and prevention. After taking samples from multiple infected people and running tests in the makeshift lab, the team has pinpointed this mysterious disease to be none other than
the West Nile virus is a virus most commonly spread to people by mosquito bites, so it can be found anywhere in the world, although it is more common in warmer weathers. Mosquitoes become infected when they feed on infected birds, and then the infected mosquitoes then spread the West Nile virus by biting other people and animals. So rare cases of transmission include through organ transplants and blood transfusions, and from mother to child during pregnancy and breastfeeding. However, it cannot be spread through physical contact, coughing, or sneezing.
From the samples we have collected from the CDC, it shows that about 8 out of 10 people who are infected do not show symptoms of the West Nile virus. 1 in 5 people tend to demonstrate symptoms of fever with slight fatigue and body ache or typical flu symptoms, and then 1 in 150 people demonstrate severe symptoms of the virus, which is what your daughter is currently experiencing. Although severe symptoms can occur in people of any age, people over 60 years of age are at greater risk. As of last month in the state of Texas, there have been 132 cases of West Nile virus, and 5 of those cases unfortunately resulted in death. In fact, the West Nile virus is actually very common in all states, including Texas.
I see. Is there any way to heal my daughter?
Well, your daughter was unfortunate enough to have developed inflammation of the brain, affecting her central nervous system after being infected by a mosquito carrying the West Nile virus. In severe cases such as that of Caroline's, patients need to be hospitalized to receive supportive treatment such as intravenous fluids, pain relievers, pain medication, and nursing care. So the best option would be to fly her to Dallas, where she can receive the best medical treatment.
Yeah, the hospital's in Dallas. We can also try treating her with interferon therapy, which is a type of immune cell therapy. Some research shows that people who receive interferon therapy recover better than those who don't receive the drug.
Hold on there for just a second. Can't Caroline just receive a vaccine?
Yeah, unfortunately, no vaccine or specific antiviral treatments for West Nile virus are currently available.
And as for the villagers who are experiencing the less severe symptoms, over-the-counter pain relievers can be used to reduce fever and relieve some other symptoms.
You must find a way to prevent West Nile virus from infecting us again.
Mayor Brown and the epidemiologists are determined to save Colville and his daughter from this harrowing disease. But fate has other plans.
Man, this West Nile virus, it's so special in so many ways. How fast it spreads, how it spreads across the entire nation, how 80% of the people that contract this disease don't even feel any symptoms. How could this be? Oh, got a phone call. Hello. Want me to come back to the office at once? Okay, I'm coming. Bye. Okay. What are we gonna do? Caroline's been kidnapped and all the medication for the villagers has crashed and disappeared. What are we gonna do? What are we gonna do?
Will this team of ordinary epidemiologists be able to win the race against time and save Colville and the mayor's daughter? Coming this summer to theaters near you.